Brown. I'm with TrueLink Medicare Advisors. We're a part of the Minnesota Credit Union Network, which is the trade association for credit unions across the state of Minnesota. And we work with Mayo Credit Union along with many others to help members who are transitioning on to Medicare or just have Medicare questions. So today's presentation is educational. We won't get into any plan-specific things, but at the end, if you want to meet one-on-one, there's a card in here in your folder, and if you fill it out and if you include an email address, I will follow up with just a thank you email for attending, and then I'll ask you, do you want to get together at some point? You know, when are you looking going on to Medicare? So if you want to communicate that way, fill out this card, and we'll stay in touch with you that way. I've been in, there's a folder over here if you want to help yourself. I've been in the Medicare space for 17 years, and we've been working with Mayo Employees Credit Union now. I think this is going on our second year. Disclosures, with federal programs, there's always disclosures, but we represent, I believe, all of the Medicare Advantage plans that are available in this area, many of the Medigap supplement plans, and many of the standalone prescription drug plans that are available. And we're also licensed across several states, so if there are Mayo employees online from Florida or Arizona or maybe elsewhere, we are licensed in both of those states, including several others. So today's is the Medicare basics, the basics of Medicare Part A and B. Our agenda is going to be, why would you want to work with TrueLink? What is Medicare? What does it cover? What doesn't it cover? The different enrollment periods and deadlines, costs associated with Medicare. What if you decide to work past the age of 65 and you have an employer plan? Do you need to sign up for Medicare at age 65? We'll talk about that. And then the private insurance options. If you watch TV at all in the fall, you'll be inundated with Medicare ads every year. Joe Namath, William Shatner, J.J. Walker, amongst many others. Your mailbox fills up with postcards and mailings. We're here to help you not have to go to them if that's what you want to do. Speaking of that, some of you may need to go through a company that Mayo uses called Via Benefits. If you started working for the Mayo Clinic prior to January 1 of 2002, most likely you're going to qualify for a health reimbursement account through Via Benefits, where they give you so much money per year to help pay for your costs. If you fall into that category, the HR department is going to let you know, but you don't want to miss out on that. So we can help advise you, but ultimately you would need to use Via Benefits if that applies to you so that you get that health reimbursement money every year. When you use us, there's never a cost for our services. If you sign up for a plan through us, we get paid a commission by the insurance carrier. With Medicare Advantage plans, the commissions have all been standardized, so we get paid the same commission no matter what insurance carrier you go with and no matter how much you pay for your plan. If you go with a Medigap supplement plan, we get paid a percentage of whatever your annual premium is. So that's how we get paid. And we're here to provide you with education, to understand the whys and hows of Medicare, and we're available throughout the year if you have questions or need assistance. So original Medicare Part A and B. These are the parts that you're going to get through the federal government, and you get them through Social Security. So if you're collecting Social Security benefits at the age of 65, they will automatically send you a Medicare card signing you up for Medicare Part A and B. If you're not on an employer plan, or both you and your spouse are retired and not working, you want to enroll in Medicare at age 65. However, if you're still working at age 65 and you're on an employer plan, and if you have a spouse who's on that plan with you, you can delay enrolling in Medicare Parts A and B, or just Part B, until you're ready to retire. Medicare Part A, there's not a monthly premium that you pay for that. It does provide coverage for hospitalization, skilled nursing, home health care, and hospice care. The Medicare Part B, there is a monthly premium. This year that starts at $185 per month. And then Part B is for your doctors, specialists, outpatient things, ambulance, durable medical equipment. That's what Medicare Part A and B. You do need both Medicare Part A and B if you want to sign up for a Medicare Advantage plan or a Medicare supplement plan. Any questions on that? Feel free to ask questions as we go along. You don't have to save them until the end if you have any also. There are things original Medicare, which is Parts A and B, do not pay for. Original Medicare doesn't pay for comprehensive dental coverage or vision coverage or hearing. It doesn't give you worldwide coverage, and it doesn't give you coverage for prescription medications. That's why you would look at signing up for a Part D prescription drug plan if you wanted to do that. There are different enrollment periods for you. The first enrollment period is called the initial coverage enrollment period, and it's a 7-month window based on your 65th birth date. It starts 3 months before the month you turn 65, the month of, and 3 months following. So this 7-month window is a time in which, if you need to sign up for Medicare at age 65, that's the time frame in which you can do it. But again, if you're still working, you can delay it, which moves us into the next, which is the special election period. You would want to start this about 2 to 3 months before the time you're going to retire and lose your employer coverage. During that 2 to 3 months prior is a time frame in which you would get signed up for Medicare Part A if you hadn't already done that at age 65, and also to get signed up for Medicare Part B. You can sign up for these coverages online with Social Security at ssa.gov. If you've ever created an account for yourself on Social Security, that's the same website. Or you can go to the local Social Security office to have them help you with it. Or you can call their 1-800 number. Just know when you call Social Security, you'll be on hold for a while. But it's also something we can help you with if you need. And of course, there's never a cost for that with us. Once you are enrolled in a Medicare plan, every year there's the annual election period. And that runs October 15th through December 7th every year. And this is a time frame in which, once you're on a plan, all the new plan information comes out every year on October 1. So if you want to compare what changes are coming to your plan, or if there's going to be big changes, you can look at other plan options during this time every year once you're on Medicare. And if you want to switch, you can during this time, and it would go into effect January 1 of the following year. Now, up until now, this annual election period has only been for Medicare Advantage plans and standalone prescription drug plans. But the Minnesota legislature a couple of years ago created the same annual election period for what's called Medigap plans. We're going to go over the differences between those. But traditionally, if you didn't sign up for a Medigap plan when you were first eligible, down the road, if you wanted to sign up for one, you'd be asked health questions. And if you answered yes to any of the health questions, you'd be denied coverage and you wouldn't be able to get one. That's changing the fall of 2026, where there's going to be an annual election period for those of you who live in Minnesota, to where if you want to start out with an Advantage plan or a Medigap plan, you're going to be able to transition back and forth each year if you choose to, without any health questions being asked. So that's going to be new for Minnesotans for next fall.
And that's state dependent?
What's that?
That is state dependent.
It's Minnesota. There's only a couple other states that allow that. So yes, if you lived in Wisconsin, they don't have that law. But yes, it is.
Yeah.
So, yes.
Are your slides going to be available?
Medicare doesn't allow us to share them. So you're welcome to take pictures if you want, but they do. I know you can take pictures, but we can't send it to you. So, yeah. And then there's a Medicare Advantage open enrollment period. So if you sign up for a Medicare Advantage plan, and let's say during the annual enrollment period you didn't have somebody review your plan, or you didn't have us or Via Benefits or somebody to see if they were still going to give you the same coverage for the next year, you thought, oh, I like the plan, I'm sure it's going to be fine. Come January, when you go to the pharmacy, you find out they aren't going to cover an expensive medication that they did this year, and you don't want to pay $800 a month for that Eliquis or Ozempic or whatever it is. You have one more opportunity if you have an Advantage plan from January 1 through March 31st. If you want to review options for a different plan that is going to meet your needs, you can switch during that time frame. Whatever month, in those first 3 months that you submit the application, then the plan would go into effect the first day of the following month. If you choose to delay your Medicare benefits. So if you or a spouse is working past the age of 65, We can compare cost to you for Medicare. I can tell you right now, most of the plans that the Mayo offers, you're going to be better off to stay on those versus going on to Medicare. But if you are going to work past the age of 65, you can sign up for Medicare Part A and delay your Part B, or if your Mayo plan is an HSA where you contribute to a health savings account, then you do not want to sign up for Medicare Part A. If you sign up for Medicare Part A and you're still working and have an employer plan that offers a health savings account, you can no longer contribute to your HSA account. So if you're in that situation, you don't want to sign up for A or B. But when you're ready to retire, you're going to want to stop contributing to your HSA account about 6 months before you're going to retire and go on to Medicare. So typically what I advise people is, if, you know, like this year, if you're 66 this year and you think I'm going to retire sometime next year, just stop contributing to your HSA account in January, and then that typically is going to cover your time frame in which you'd want to stop contributing to your HSA. Yes?
Why would you not want to keep building your HSA?
Well, if you would, but once you go on to Medicare Part A, if you're beyond the age of 65, they're going to look back 6 months if you contributed to an HSA account. And if you did, they're going to tax you on that amount. Yeah, it's not a huge deal, but you would get taxed on the amount you contributed to if you didn't stop 6 months prior to going on to Medicare Part A. Like I said, you can apply for Medicare A and B online with Social Security, or we can help you with that. There is a form that if you delay enrolling in Medicare Part B, you and or your spouse, that your employer needs to fill out, and it's called the Request for Employment Information. You fill out Section A, your employer fills out Section B, and all this form is doing is verifying with Social Security that yes, you and or your spouse had employer coverage beyond the age of 65, and when you apply for Medicare Part B, this form gets submitted along with the Part B application, and then you're not being penalized for not signing up for Medicare Part B at age 65. So you may have had people tell you, oh, if you don't do it at age 65, you're going to pay a penalty for the rest of your life. No, if you're still working and have an employer plan, this is the form that gets submitted when you do apply for Part B, and that makes sure you don't pay that penalty. Any questions on that? Yes?
I have a question about your prior comment.
Okay.
So my husband worked at IBM and has an account that he can use for like dental and eye.
Mm-hmm.
So does that end when we go on Medicare?
You would need to ask IBM that. You may still have the option to keep that. I don't know. I've worked with a few IBM folks down here, but I haven't worked with enough to know for sure. Yeah. And then there are income impacts once you do go on to Medicare. So for people who are going to fall into a low income category once you retire, there's something called extra help that's available. It will help lower the cost of your Medicare Part B premium, that $185 a month, and it will help lower your Part D premium, and it will also help pay for prescription drug costs potentially. But on this chart, if you look at the family size, and then when you go across the top, the percentages are the percentage of the federal poverty guidelines. And based on your family size, if your income is going to drop into one of those levels at any time post-retirement, then you're going to be available for you're going to qualify for extra help. You can contact Social Security to apply for that, or you can contact your local County Department of Human Services, and they can help you apply for that too. And it may not be for you, but maybe you know of someone who's maybe they're in their 80s or something and they're just really struggling financially. A lot of people aren't aware that there is extra help available, but there is. The opposite of that is if you are in the higher income categories, there's something called an income-related monthly adjustment amount. And every year, once you go on to Medicare, the Social Security works with the IRS to look at your federal tax returns from 2 years ago. It's always going to be your returns from 2 years ago. This year, the thresholds are if you file your taxes singly, and if your modified adjusted gross income from 2 years ago is $106,000 a year or more, they're going to add on a high income surcharge. If you're married filing jointly and your modified adjusted gross income from 2 years ago was $212,000 a year or more, they're going to add on a high income surcharge. So with the middle column here, the amount of increase for Part B, you can see if your income fell into one of those categories, they're going to add $74 a surcharge onto the $185. As you go down, the higher your income is, those are the amounts they're going to add on to the $185 per month. And then the far column to the right, they're going to add on surcharges for your prescription drug portion also. And that's going to be for every month for the rest of the year, and then it gets reevaluated every year after year after year. These thresholds do tend to increase every year, but if you fall into that category, Social Security is going to let you know once you apply for Medicare Part A and B if you fall into the high income surcharge, and they're going to tell you what that's going to be. And if you feel your income was based on special circumstances like an inheritance or something, then typically you can appeal that, but you can appeal it, but if it's just based on general income, you're probably not going to win that appeal. You're going to pay the high income surcharges. Yes?
Yes, we've got a question online.
Yes.
Can you switch Medigap plans at open enrollment without going through underwriting?
Well, you're going to be able to switch Medigap plans in Minnesota starting next fall, October 15th through December 7th, without underwriting. So that's the new law that the legislature created in Minnesota. There's only a few states where you can do that. Minnesota is going to be one of them starting next fall. Any questions on the high income surcharge? Okay. Private health insurance options. So there are different options for you. There's what's called Medicare supplement plans or Medigap plans. There are Medicare Advantage plans, also called Part C plans. And then there are standalone prescription drug plans called Medicare Part D plans, and we will go over each of these. In Minnesota, we call Medigap plans a little different than what most of the nation does. For most of the states across the country, they're going to be called Plan F or Plan G, Plan N, Plan L. In Minnesota, we don't call them that. They're called the basic plan, extended basic, copay plan, and high deductible plans. And there's a lot of different insurance carriers that offer these types of plans in Minnesota. With Medigap plans, you aren't going to have a network of doctors. Any doctor across the country that's accepting Medicare, your plan's going to be accepted there if you have a Medigap plan. It travels with you. If you leave the state or the country, it'll give you international coverage. How that works is you pay the bill up front. When you get back, you submit your expenses and they reimburse you typically 90%. And if you relocate or move to another state, you're going to be able to keep your Medigap plan from Minnesota. The downside to that is Medigap plans in Minnesota are some of the highest priced plans in the country. So let's say if you moved across the border into Wisconsin, their Medigap plans are probably 40 to 50% less per month in premiums than what Minnesota's are. But just because you move doesn't mean you automatically qualify for a Medigap plan in Wisconsin. You could apply for one, but you're going to be asked health questions if you do that. And if you answer yes to any of the health questions, Wisconsin or another state would deny you, so you would keep your Minnesota plan. So they're great in Minnesota, but again, if you move, you don't automatically qualify for another option. With the Medigap plans, it gives you medical coverage. Medigap plans don't include prescription drug coverage, and they don't include dental or vision coverage. With Medicare Advantage plans, and we also have what's called Medicare cost plans in some of the counties down in this area, they do include your medical, your prescription drug, dental, vision, hearing, free gym memberships. There's a lot of extras they include for one monthly premium. So they're going to be a little bit more economical than a Medigap plan, but that doesn't mean that's the reason why it's the best option for you. If you choose to meet with us or with VIA benefits, it really comes down to what matters to you. There's not one best option for everybody. It's what's important to you. With a Medicare Advantage plan, there are provider networks. The nice thing about Advantage plans in Minnesota is we have probably the strongest plans in the country. where with different insurance carriers in Minnesota, 97% of providers are in their network. So that's a huge number. I'm licensed in several states, and there are states where not even 50% of providers are in network. So if you read about Advantage plans online, some people really trash them. They're probably from other states, because some states I wouldn't want an Advantage plan, but in Minnesota they're really, they have a lot of benefits with them, and they have a strong provider networks. There's two different types of Advantage plans in Minnesota. There are HMO plans and there are PPO plans. If you go with an HMO plan, you're going to be more restricted on seeing specialists or using it if you're out of state and so forth. So I tend to advise clients to stay away from HMO plans if you plan on doing any traveling, and go with what's called a PPO plan. If you go with a Medicare Advantage plan that's a PPO plan, you're going to have coverage all across the country, and you're going to be able to see a specialist without referrals and so forth. So there's a lot more freedom with a Medicare Advantage PPO plan than there is with a Medicare Advantage HMO plan. Like I said, there's a network of providers. If you move to another state, or even if you were to move to another county, that can change depending on what county in Minnesota. If you have an Advantage plan, you might have to look at finding a different Advantage plan in the county. And if you move to a different state, you would have to find another plan. But again, that's something we can help you with, or Via Benefits can help you with. So you would lose it depending on the county you move to, and you would lose it if you move to another state.
I have a question.
Yes.
Is the Medicare Advantage PPO similar to Medigap? Is it more similar to Medigap?
Well, Medigap doesn't have any network of providers, so that's probably the biggest difference, yeah. And Advantage plans don't ask you any health questions, where Medigap plans would, unless you did it during the annual enrollment period. But with Medigap plans, if you're a smoker, you're going to pay higher rates than if you're a non-smoker. With Advantage plans, they don't ask you those questions. So you don't pay higher rates whether if you're smoker or non-smoker. With Advantage plans, the benefits can change from year to year. Medigap plans, the benefits don't change, so that's another difference. The benefits have typically been getting stronger, but they can change from year to year, and the premiums can change from year to year. With several Advantage plans this year, the premiums actually went down. They may go back up next year. We won't know until October. But with Medigap plans, they're steadily increasing in price. Any questions on that? Yes?
Does Mail accept Medigap?
That's a good question. They do. They sent out a letter that was kind of misleading. There's only certain Medigap plans that they do accept, and it's just the clinic in Rochester here that accepts Advantage plans. If you went to the clinics in Florida or Arizona, they do not accept Medicare Advantage plans. They accept Medigap plans. But here in Rochester, the Mayo Clinic and the Mayo Health System accepts certain Medicare Advantage plans. And that's something we could go, I mean, if you ask me which ones, I can tell you. I'm not allowed to mention their names unless I get asked, but yeah. Yes?
And why don't providers here at Mayo Clinic Rochester like Medicare Advantage plans then?
It depends on which company that you go with. So the ones that have the strongest reputation in this area are going to be Blue Cross and Medica. United Healthcare, you're going to find providers who love or hate them. Humana, very few people love Humana anymore in Minnesota. So it really, Blue Cross and Medica are nonprofits. United Healthcare and Humana are for-profits, and they really operate a little differently. Yeah. Good questions. Did I answer your question, sir? Yeah, okay. And then if you go with a Medigap plan and you want prescription drug coverage, then you would also need to sign up for what's called a standalone Part D prescription drug plan. Each insurance carrier that offers these plans has a formulary, which if you're familiar with that, that's a formulary is just a list of medications that the plan will cover. That formulary can change from year to year. And all the plans offer mail order service. They're also all going to have tiers of coverage. Typically, tiers 1 and 2 of whatever insurance carrier it is, it's going to be your generic medications. Tiers 3 and 4 are going to be brand name medications. The tier 5 is going to be specialty medications, And then a few insurance carriers also have a Tier 6. Those are kind of going away, but Tier 6 would be the lowest cost generic medications. We would go over all this with you if we met with you, yes. Did you have a question? Oh, okay, yeah. If you don't enroll for a Medicare prescription drug coverage when you're first eligible, that means either when you go on to Medicare Part A and B and or you've left employer coverage. I've been doing this for 17 years and I've had people over the years say, I don't take any prescription medications and I'm never going to. Some of them never do. Some of them come back in 5 years and say, my doctor's prescribed, I want to sign up for a prescription drug plan. There's a penalty they have to pay, and it gets added on for the number of years you were without. It gets added on to your monthly premium, and you pay it every month for the rest of your life. So there are options in Minnesota where you can get a prescription drug plan for $0 a month. So I would advise at least doing that, and instead of just saying I'm never going to take medications, but it's a choice that you're free to make for yourself. So,
Can I ask you a question?
yes.
Just said, so you said that's if you're on Medigap, or does it matter whether you're on traditional Medicare?
So Medigap, you would want to add, they don't cover prescription drugs, so you would want to add on a standalone plan. If you go with a Medicare Advantage plan, they include prescription drug coverage as part of your monthly premium. Yeah. And if we meet with you, even if you need to go through VIA benefits, what we're going to do is ask you what prescriptions that you're taking, what doctors you're seeing. We'll run them through the Medicare website to at least, we can advise you if you can't go through us and you have to go through VIA, we can advise you on which plan is going to work best for you in Minnesota. So, and I think VIA does the same thing. It's just, it's going to depend on who you get at VIA to help you.
Is there a timing in the year where plans announce their changes?
Yes, so every year on October 1st, all the new plan information for the following year gets released. Yeah. Good questions.
So you want to do it before first?
Well, October 1st, like if we were to meet with you in October, we would be able to share with you all the new plan information for the following year. So that annual election period that we talked about from October 15th through December 7th, that's the time frame in which you can look at plans for the next year and make a switch if you want to. Does that make sense?
So if we decide if we want to go next month, that's in October,
Yeah. So if you decide you want to go on to Medicare in August, then we can sit down with you and review all your options for August. And then when October comes along, if you want to say, well, I want to see if there's something better for me for the next year, then that's a time frame in which you could switch from the plan you chose this year for next year. Or if you're happy with the plan, we could at least review to see if there's any changes. And if you're happy with what you have and there's no changes, it'll just keep renewing and renewing. Yeah. Something new for this year is in the past there was something called the donut hole or the coverage gap. And what that was is once you and the insurance company had paid out like $5,000 towards the cost of your medications, you fell into the donut hole where you had to pay 25% of the cost of your medications. The government has done away with that. And what they've replaced it with is, it was new in January, all medication costs have been capped at $2,000 per person per year. That's not always a true $2,000 out of your pocket. They came up with this complicated national formulary. For some people, it's a lot less than that. But once they've determined you've hit, if you do, many people don't hit it, but if you do hit that $2,000 cap before the end of the year, then the insurance companies are now required to pay 100% of the cost of your medications for the rest of the year. So the people who generally hit that are ones that are on Tier 3 medications like Jardiance or Eliquis or Ozempic or something like that. Those get expensive, and typically by the end of the year you're going to hit that cap on those. For some people, I had a client where she was going to hit that the second month of when her plan started, and once you're retired, shelling out $2,000 in a month or two can be challenging. So the government also came up with a Medicare prescription payment program. Every insurance carrier that offers Medicare Part D plans has to offer this to you. There's no cost for the program. You would enroll directly with your insurance plan, and what they do is they spread your costs out over 12 months instead of you getting hit with it in 1 or 2 months. If you sign up for it, if that's something that you would need to do, when you sign up for it, when you go to the pharmacy, then you don't pay anything for your medications at the pharmacy. Your insurance carrier bills you each month for them. And again, that's new for this year. But, and then once you hit, again, the $2,000 threshold still applies. If you hit that $2,000 threshold, then you no longer pay anything for your medications through the end of the year. Any questions on this? Okay. So premium costs with Medicare and private health insurance options. We're just going to kind of recap here. With Medicare Part A, as long as you paid into the Medicare tax, you or your spouse, for 10 years or more in the United States, you don't pay a monthly premium for Part A. Medicare Part B this year is $185 a month. That can change a little bit from year to year. That gets announced either in October or November, if it's going up or down or staying the same. And then on the left, if you go with a Part C Medicare Advantage plan, in Minnesota, in this area, you can get a plan starting at $0 a month and then go up to $200 a month. With an Advantage plan, you're going to get your medical, prescription drug, dental, vision, hearing, all of that's rolled together for 1 monthly premium. On the right, if you choose to go with a Medigap supplement plan, the high deductible plans are going to start around $75 a month. And if you go with a plan where you just pay the $257 deductible, and then after that you have no co-pays, if you're a non-smoker, those plans run around $300 a month and can go up from there. If you're a tobacco user, they'll be even higher. If you go with a Medigap plan, you'd want to add on a Part D prescription drug plans. Those plans run from $0 to over $100 a month, depending on which option works best for you. And then if you want dental and vision coverage, you need to add on policies for those things too. So Medigap plans tend to be, the monthly premiums tend to run higher than Advantage plans. But again, if we meet with you, we're going to sit down and help you talk through what's most important to you. Not everybody goes with Medigap, not everybody goes with Advantage plans. It's really what matters most to you. So don't let anybody tell you one's better than the other, or just because a neighbor or a friend chose this, that doesn't necessarily mean that's what's best for you.
So can I just clarify?
Yes.
Part B, is that the part that's income-based on your 2 years of income?
It is.
Okay,
It
so
is.
it's not just 185 for everyone. It's
If you're higher income, then you get a surcharge added on. And that gets paid to the government. So if you're collecting Social Security benefits, or once you do, your Part B premium gets taken right out of your Social Security check. If you're signing up for Part B and you're not collecting Social Security benefits yet, you'll get a bill in the mail from Social Security to pay that. Yeah. So any questions on what we went over? The permission to contact form, again, is this form in your folder. And if you're online, I know that Mayo sends out usually something in the afternoon, all the attachments that we have here. But if you fill this out and leave an email address, I will follow up with you. Just say thank you for coming. Do you want help with your Medicare? If so, what's the timing of that? And would you like to meet face-to-face, and so on. You're not required to fill this out. But again, if you do, that's how we'll be in contact with you. But with that, did any of you come in with questions that maybe I didn't touch on, or you just have questions about something that you're still confused on with Medicare that I can answer for you?
I thought you might cover how Medicare A has changed from our parents' Medicare A, such as now we are only allowed up to XYZ dollars over, is it 100 and so many days? The first 60 days, if we're hospitalized for Medicare A, it will cost us, I believe, $480. No, that was, but anyway, $167 or something.
Yeah,
if
let me
we get
go.
hospitalized. Do you have anything on that?
Yep. Go back to that. Okay, so on the hospital Part A, if you have supplemental coverage, normally these deductibles don't apply. But if you just went with original Medicare Part A and B and you didn't add on a Medigap plan or an Advantage plan, if you were in the hospital, you'd have a deductible to pay of $1,676. That changes every year for the first 60 days in the hospital. Most people aren't going to stay more than 60 days in the hospital, but if you did, it shows that. Also, if you had a hospital stay and were released and then were readmitted to the hospital more than 60 days after you were released, you're going to pay that deductible again with original Medicare. With Advantage plans, you just have a copay. With Medigap plans, it depends on the type of Medigap plan you go with as to whether or not what your deductible may or may not be. Did that? Yeah, it has changed some over the years. Yeah. Yes?
Are you licensed in Wisconsin?
I am licensed in our agency. I and my agency are licensed in Wisconsin, yes. Wisconsin's kind of an example where the Medigap plans are much more competitive in Wisconsin than what they are here. And the Advantage plans aren't quite as robust in Wisconsin as they are in Minnesota. So that's where, if you're a Wisconsin resident, you really want to take a closer look comparing Medigap to Advantage plans, because both of them are competitive, very competitive with each other in Wisconsin. Yes?
I have another question in regards to Medicare Gap and Medicare Advantage. At one time, and you said the law in Minnesota has changed, but not for other states.
Yeah.
At one time, you only were allowed one time to go from Medicare Advantage to Medicare Gap, if it benefited you. But a lot of people are saying, I'm on Medicare Advantage, I cannot switch to a Medicare Gap.
Up to this point, they couldn't without being asked health questions. But again, with that new law going into effect the fall of 2026, they're going to be able to without being asked health questions. A lot of people aren't even aware that the legislature created that.
Yeah.
So you
Yeah.
can switch every year.
You could if you wanted to, as long as the legislature doesn't change it again at some point. I don't think they will. It's very disruptive when they do those things, but yeah.
Nice.
Yeah. And again, you know,
It's 2026, not this fall.
it's the fall of 2026, yes. It actually that law goes into effect August 1 of 2026. It was going to start this fall, but then the insurance carrier said we need more time to prepare, so the legislature pushed it back, the effective date pushed it back 1 year to 2026. Yes?
I see Medicare Part B there has ambulance coverage.
It does.
Is that how much per trip?
So if you just have Medicare Part A and B and you don't have any supplemental coverage, there's a deductible of $257 you'd have to pay, and then you're going to pay 20% for all of your services. And there's no maximum out-of-pocket protection. So if you just have original Medicare A and B, you have catastrophic things happen where you have hundreds of thousands of dollars in medical bills, you're going to pay 20% of that if you don't have any, because there's no maximum out-of-pocket protection with just Medicare A and B.
The patient pays 20% or the company?
The patient pays 20%.
And they
Yeah.
pay the rest?
Medicare would, yes. With Advantage plans, it's just a straight copay. With Medigap plans, depending on the type of Medigap plan, you might end up paying the $257 deductible and then nothing after that.
Are you familiar with MASA?
MASA?
Yeah.
Mm.
It's a company, like, out of Florida, yeah. And they do ambulance.
Oh, like where you can pick up a rider in that?
Yeah, you can.
I actually got something in the mail from them to go to a free thing at Pizza Ranch. But they're saying most people aren't aware of the things Medicare doesn't offer. Well, in Minnesota, I just don't see the need for it, because if you have an Advantage plan, you have a copay and it gets paid. With Medicare Medigap, even if you have Medigap, it's really for people who just have a Medicare A and B, which is very few people these days. But yeah, now that you point that out, I'm not sure I would spend my money on it, but again, it's a personal choice.
You can get a lifetime membership for $5,000.
Yeah.
And they'll cover many things like moving pets, moving your vehicle,
Oh.
stuff like that.
Okay.
It's like I say, like you said, it's a rider,
Yeah.
extra.
Yeah, and maybe for some people's situation, it's a great option for them. Yeah.
And then curious, why would someone not choose something in addition to just what's offered with Part A and B? Who would be in that
Well, like I said, I've been doing this 17 years, and I have people who tell me they don't get sick and they're never going to. And that's your choice. Yes.
So I have a similar question. So I had a friend that was told, she worked at Mayo, she was told to stick with the original Medicare because you can't choose who you want to go see. And she wanted to make sure she could go to Mayo because she's got some major things.
Yeah.
So is that, but you were saying then, is it an Advantage plan you can go to whoever you want?
No, with an Advantage plan, there's networks, but you know, like for Blue Cross, Medica, a few others, 97% of providers in Minnesota are in network with them, so it's really not a big deal in Minnesota. In other states, it's a huge deal, depending on what state you're in. With but then if she wanted to go to, if you have an Advantage plan and you want to go to the clinic in Florida or Arizona, they won't take an Advantage plan, the Mayo Clinic won't. Just Rochester does. If you have Medigap, you can go to any of the Mayo Clinic locations.
I'm still getting to all this, but so Medigap is, what's the difference between like the Advantage plans and Medigap? 'Cause
Okay.
I had an impression that you took Medigap if you were on original and there was a gap in coverage or something. So.
Well, you have to have Medicare Part A and B for either Medigap or Advantage plans. But again, with Medigap plans, you're going to typically pay more for it, but you can get a Medigap plan where you pay that $257 deductible and then you don't have any co-pays for the rest of the year. And it's going to be accepted nationwide. Any facility that takes Medicare will take that. With Medicare Advantage plans, in Minnesota, you would need to use in-network providers. And then with some of the insurance carriers, once you're outside of Minnesota, if you're traveling, any place that takes Medicare would take your Advantage plan if it's PPO. Other carriers have a network, national network across the country. So the Advantage plans are network-based. The Medigap plans are not. You're going to pay more for Medigap, but there may be reasons why you want to do that. In Minnesota, you're going to pay more. That's not always true across the country.
If
Yes?
you're working past 65, would it be best to cut back on the income that you make? Say if you plan on maybe just being done completely by 67 or 68 because they look at the last 2 annual income?
Yeah, they look at your returns from 2 years ago. The biggest area where people get into trouble is if they take their 401 rollover, a distribution for something like retirement fund or something, 2 years before they're going to go on to Medicare, and then they get hit with those high income surcharges. And you can appeal that, but typically they're going to deny it if it's because you took a rollover. So yes.
To a Roth is different, is that right?
I'm not a financial planner, so I don't. I just know they look at your modified adjusted gross on your tax returns, but that's an area where when people take distribution maybe 2 years before they're going to go on to Medicare, that's where they can get hit with the high income surcharge. Or maybe you just have a high income, yeah.
But that process is repeated every year.
Mm-hmm. Yeah.
So if you had that big spike, you wait out that storm,
Yeah.
your income comes back down and it adjusts.
Right. So every year the IRS and the Social Security work together. They look at your returns from 2 years ago. If you drop below whatever the threshold is for that year, you no longer pay the surcharge.
Yep.
Yeah. Any more questions online? Yes, sir.
What is the policy of the penalty? If there is a violation, say you didn't have that Part B or Part D on time,
Yeah.
the violation,
So the penalty,
forever?
yes. So there is a penalty for Part B if you don't sign up when you're first eligible, meaning either when you turn 65 or when you retire past the age of 65. The penalty is 10% a year for every year you didn't sign up for it when you should have. So if you waited 5 years, that's a 50% penalty, and it's going to be whatever like this year it's $185. You'd have 50% of that added on to your annual or your monthly premium, and it's every month for the rest of your life. For Part D, if you don't sign up when you're first eligible. It's a 1% penalty of the national average, which comes out to about $4 a month. So let's say you went 5 years without prescription drug coverage, and then because your doctor prescribed something, you want to sign up for one. If you take that $4 times 5 years, that's an additional $20 a month that would get added on to your, and these are just approximations, but it'd get added on to your premium every month for the rest of your life. Yep. Yes?
I have original Medicare with Medigap. Could you repeat what I need to do if I need medical care outside the U.S. when traveling?
Yes, well, I always advise to get a travel policy if you're doing that, but you don't have to. So with original Medicare, it depends on the carrier you're with, but you would pay the bill up front, and then when you get back, you submit your expenses to your insurance carrier, and then you work through that whole process, and typically they're going to reimburse you 90% of those costs.
You know, the HSAs are so nice
Mm-hmm.
when you do it. So basically, no one on Medicare are putting away for HSAs, is that true?
Once you're on Medicare, you can no longer contribute to an HSA. Yeah.
Really?
Can you take your money out?
Yes, once that money in your HSA account, that is yours until it's used. And then again, if you were employed with the Mayo Clinic, if the health system's different, but the Mayo Clinic, if you started with Mayo Clinic prior to January 1 of 2002, you're most likely going to qualify for a health reimbursement account through Via Benefits. That's around $1,700 a year. That's money that the Mayo Clinic gives you to help pay for your Medicare expenses. If you started after that time frame, those folks generally don't qualify for that reimbursement money.
Just to poke at that HSA, is it because, you gotta fill out a form every year that's saying you're on a high deductible insurance? Is that why?
It is. Once you're on Medicare Part A, they no longer consider you to be a high deductible, and so that's why you can't contribute.
That's the trigger.
Yes.
Yeah.
Yeah.
Okay, cool.
Yeah.
When does the 6 months start for the HSA? So if your birthday's January 15th, do you have to end it by?
No. So if you enroll in Part A based on your 65th birth date, that rule doesn't apply. If you're beyond the age of 65 and then enroll in Medicare Part A, let's say you're 67, you didn't sign up for Part A because you're contributing to an HSA, they're going to backdate your Part A effective date 6 months. So whatever that 6-month period is, you don't want to contribute to an HSA during that time frame, or you'll get taxed on your contributions. Does that make sense? Okay. Your Part B, you can request, if you're beyond the age of 65 when you apply for Medicare Part B, you can request it always starts the first day of the month, but you can request the month you want it to start for your Part B. You guys have good questions.
Does your HSA allow you to reimburse yourself for any of your Medicare monthly premium?
It depends on the type of plan that you're on. So with Medicare Advantage plans, you can use your HSA money to pay your monthly premium. If I remember correctly, with Medigap plans, you cannot use it to pay your monthly premiums. They changed the rule on that a few years ago, so I believe that's correct, yeah. Yes?
Does a Medicare plan pay anything for eye, dental, or hearing?
No.
So that's something separate you got.
Yes. So if you go with a Medigap plan and you want vision and eye coverage and that, if you're able to if you have something through an employer that they allow you to keep in retirement, that's probably a good idea if you go with a Medigap plan, or there's standalone plans you can sign up for dental and vision. Okay. Well, again, if you fill out that form, if you want us to be in contact with you, just leave it with me before you leave. But thank you for coming.
Thank you.
Yeah.